Hi, this is the Blitz 2025 review of postpartum care. We have talked quite a bit about managing hypertensive disorders over the last couple of years and making sure that we are treating our severe range hypertension patients in a timely manner within 60 minutes of identification of severe range hypertension with either nifedipine, labetalol, or hydralazine. We've been doing very well. Our 2024 year-long performance was was 94%, and we wanted to be, our goal was greater than 85%, and we surpassed that. Don't forget about signing our patients up for the My Heart program. They do have to opt into it, and you do have to sign them up with their cell phone number into the correct form. In addition, while we're at it, the other MPOTA program is the Pregnancy to Parent Wellness Program. Everybody in postpartum is eligible for this program, so it needs to be signed in with their cell phone number as well. We continue to screen for sepsis on all of our patients twice a day at 7 and at 1900. And it needs to be done by 10:59 and 22:59 every day. And it must be done within 60 minutes of taking the last vital signs in order for it to be accurate. Newborn care. Our providers want us to focus on hand expression and pumping, so lots of stimulation at the breast. And where we're kind of heading with all of this is that all of our patients are going to be encouraged to do some hand expression pumping after each feed. The more stimulation you get at the breast, obviously the more milk supply you get. So it's really important for us to initiate that. If we're not comfortable with how to do hand expression, there are some videos on our Get Well network that you can look at, and also send it to our patients so that they can take a look at the how to do hand expression if they are not familiar with that. Our donor milk program has been going very well, but it is very specifically for us, for our patients that are less than 37 weeks and or weigh less than 2,000 grams. If you have a patient who's in labor that's less than 37 weeks, you can go ahead and already get that ordered for them before delivery. It'll be ready for them at birth. It is a nurse-driven consent, so you will get consent from on an iPad, and we have iPads at the clerk's desks. And then you also have to put the order in. It can be under either mom or baby. Obviously, be under mom if the baby's not born yet. So, and it's heat pasteurized donor milk that you will do, and then make sure that you document it under I's and O's when the baby is actually eating the donor milk. Eat, Sleep, Console is a functional assessment, which we begin at 3 hours of age, and then every 3 hours as needed for our babies who are born with substance use. It's done after the feedings. It is a good way to document non-pharmacological interventions. It's a way of keeping the mom and the baby together. It used to be that all of our substance use babies were sent off to NICU, and then they would be treated with morphine, sometimes unnecessarily, when studies have shown that if you keep them together and you try to maintain their comfort so that they can eat comfortably, sleep comfortably, and can be consoled, that they get through their withdrawal better that way. So they're green zone, yellow zone, and red zone. And each zone, you know, if the baby's fussy, you will educate the parent on how to, maybe the baby needs to be swaddled better, maybe the baby needs to be carried, maybe the lights need to be dimmed. And then you'll go back in and you'll do an assessment and see, and we'll continue to do some non-pharmacological interventions until such time that the baby demonstrates that it needs some pharmacological interventions. So those are the patients that we see through our Partnering for the Future clinic, which is now run by Alex Peel. There's a whole website on them if you wanted to take a look at that. Then we talk about safe sleep and why safe sleep is so important. We did already this year, 2025, have a baby drop, and which resulted in a skull fracture. So we need to make sure that we're educating our parents, making sure that they're signing the safe sleep form. and leading by example. So, you know, no blankets, no extra blankets in the crib, baby sleeps on the back, you know, no pillows, stuffed toys, all of that. And very important for us to educate our patients on that. And that's it. Thank you.